Good afternoon. This is Dr. Adam Kopsky from Advanced Rehab and Medical. I hope you guys are having a great start to your week. I just want to come on here and give you a little information on our topic this week when you come in. So once again, we're doing these whiteboard topic of the week. So when you come into the rehab area or at the receptionist, the front desk, be sure to grab you one of these handouts. Each week we have new topics and they are very informative. And we have a lot of patients come in and even grab myself or some of the staff members to ask us a little bit about this. So, you know, it is good information. Basically on some good topics that aren't necessarily back or neck pain, that maybe you guys are dealing with different conditions in your body that you didn't know chiropractors can help. So that's one thing that these topics are very good about. So this week what I just wanted to touch on briefly was actually the study that came out that talks about how actually they took two different groups with knee pain. And what they did was they targeted one group to do knee exercises to target that knee pain, and another group that targeted the to hip exercises. And so what they found was actually that the group that did the hip exercises actually got better improvement and decreased pain for their knee pain than those that actually just targeted the knee. And one reason that we see that this is very common is we have a condition in our knee called, that's one of the most common conditions, is called patellofemoral pain syndrome. And so what they did was when they took these studies with these x-rays, that they actually saw that when you're weight bearing and standing, that your hip actually will internally rotate. And when this happens, then we actually see that patella right there in the kneecap start shifting outward. And so actually when you can actually exercise these hip muscles, particularly the hip abductors, which are on the outside of your hip, if you go on your side and do exercise those, then we can actually gradually bring that hip back out where it's not caving in. And when that happens, then we add stress off of that kneecap. And so it allows that lateral patella right there to shift back to the midline, which results in decreased pain and improved function. So this study right here is actually very informative. So one that's the hardest things, a lot of patients come in and they'll talk about, oh, I have knee pain, so why are you addressing a hip or even the foot issue? Because as you can see, the knee's in the middle. So if we have a dysfunction at the hip or the foot, you can see how the stress right there at the knee, particularly the inside of that knee, is going to be irritated and stressful. So even though we treat the knee, we also look at where the actual cause of your knee pain may be coming from. So either kind of usually the hip and low back or to the foot. And so if we can address all those at one time and then you know, treat those areas, then we can get you to functioning better. So once again, I hope this topic was informative, and if you have any questions, don't hesitate to reach out to me or one of the staff members. Hope you have a great rest of the week.